What if I told you that the vitamin sitting in your medicine cabinet right now could be silently setting you up for a stroke? As a brain doctor who has spent over 2 decades treating patients in emergency rooms and neurology wards, I have witnessed something that absolutely shocks me. The very supplements that millions of seniors take every single day, believing they are protecting their health, are actually creating a ticking time bomb in their bloodstream. You walk into any pharmacy, any grocery store, and you see rows upon rows of vitamins marketed specifically to people over 60. The labels promise stronger bones, sharper minds, and vibrant energy. What they do not tell you is that 5 specific vitamins, when taken in the doses commonly found in these over-the-counter supplements, can quietly raise your stroke risk by up to 300%. I am talking about vitamins that your own doctor might have recommended, vitamins that seem as harmless as drinking water. My name is Dr. Richardson, and in my years of practice, I have seen too many preventable tragedies. Patients who thought they were doing everything right, who followed every health recommendation, who took their vitamins religiously, only to find themselves fighting for their lives in my emergency room. Today, I am going to share with you the 5 vitamins that could be putting your brain at serious risk, and more importantly, I am going to show you the simple changes that could save your life. Before we dive deep into this critical information, I need you to do something for me. If you are curious about which vitamins I am talking about, type the number 1 in the comments below. If this information is completely new to you, type 0. This interaction helps me understand my audience better, and it helps YouTube share this potentially life-saving information with more people who need to hear it. The 5 vitamins I am about to discuss are vitamin D, vitamin E, vitamin B6, vitamin A, and niacin. Each one of these has a dark side that the supplement industry does not want you to know about. Each one can transform from helper to hazard in your body, especially as you age, and your body processes these substances differently than it did when you were younger. Let me start with vitamin D, the sunshine vitamin that everyone seems to be talking about. You have probably heard that vitamin D is essential for bone health, immune function, and overall vitality. Your doctor may have even told you to take it after a blood test showed you were deficient. Here is what they probably did not tell you. When you take too much vitamin D, especially the megadoses found in many supplements, it does not just help your bones absorb calcium. It forces your body to absorb dangerous amounts of calcium from your intestines, flooding your bloodstream with levels that your aging kidneys cannot properly filter. Let me tell you about Walter Jenkins, a retired Navy veteran who came to my emergency room on a Tuesday morning in March. Walter was the picture of health consciousness. He exercised regularly, ate his vegetables, and took his vitamins religiously. Every morning for 3 years, he had been taking a vitamin D supplement that contained 4,000 international units, believing he was protecting his bones and boosting his immune system. Walter collapsed while gardening in his backyard. His wife found him unconscious among his tomato plants. His face twisted in a way that immediately told her something was terribly wrong. When the paramedics brought him to me, his speech was slurred. His left arm was completely paralyzed, and his blood pressure was dangerously elevated. The CT scan revealed what I feared. Walter had suffered a massive stroke. But here is the shocking part. Walter's stroke was not caused by the typical risk factors we usually see. His cholesterol was normal, his blood pressure had always been controlled, and he had no family history of stroke. What we discovered in his blood work was a calcium level that was off the charts. His vitamin D level was more than double the normal range. The excess vitamin D had been quietly building up calcium deposits in his arteries for months, making them stiff and narrow, creating the perfect conditions for a stroke. The recommended daily intake of vitamin D for adults over 70 is just 600 international units. Yet the supplement Walter was taking contained 4,000 international units, nearly 7 times the recommended amount. Most over-the-counter vitamin D supplements contain between 1,000 and 5,000 international units per pill. Some contain as much as 10,000 international units. What Walter did not know was that his body was storing every excess unit of this fat-soluble vitamin, and it was slowly poisoning his cardiovascular system. Here is what you need to understand about vitamin D and your aging body. When you are young, your kidneys are efficient at filtering excess calcium. But as you age, your kidney function naturally declines. The calcium that vitamin D helps you absorb has nowhere to go, so it begins to accumulate in your arteries, your heart valves, and even your brain tissue. This process is silent. You feel fine while it is happening. There are no warning signs until the day you collapse like Walter did. If you are taking vitamin D supplements, I need you to do 3 things immediately. First, check the label and see how many international units you are taking. Second, get your blood levels checked to see if you are in the toxic range. Third, talk to your doctor about whether you actually need supplementation at all. Many people think they are deficient, when they are actually within normal ranges. Now let me talk about vitamin E, the antioxidant that was supposed to protect your heart and brain. For decades, vitamin E has been marketed as the fountain of youth in a pill. The theory sounds logical. Antioxidants fight free radicals. Free radicals cause aging and disease. Therefore, taking antioxidant supplements should make you healthier and help you live longer. The problem is that when scientists actually tested this theory in large-scale studies, they discovered something alarming. High-dose vitamin E supplements do not just fail to prevent heart disease and stroke. They actually increase your risk of both. But the danger I want to focus on today is something even more sinister. Vitamin E can thin your blood to dangerous levels, increasing your risk of brain bleeds, especially if you are taking any other blood-thinning medications. Dorothy Simmons was a 68-year-old grandmother who prided herself on staying current with health trends. She read health magazines religiously and followed the advice of various wellness experts she found online. One of the supplements she had been taking for over 2 years was a high-potency vitamin E complex containing 400 international units per day. She also took a baby aspirin daily for heart protection, as her cardiologist had recommended. Dorothy came to my emergency room complaining of the worst headache of her life. She described it as feeling like someone was drilling into her skull from the inside. Her speech was slightly confused, and she kept asking the same questions over and over. When I performed a CT scan of her brain, I saw exactly what I feared: a hemorrhagic stroke. Blood was leaking into her brain tissue, creating pressure that was literally crushing her brain cells. What made Dorothy's case particularly tragic was that this brain bleed was completely preventable. The combination of her daily aspirin and her high-dose vitamin E supplement had created a perfect storm in her bloodstream. Both substances thinned the blood, and when taken together, they had made it impossible for her blood to clot properly. When a small blood vessel in her brain developed a tiny tear, the recommended daily intake of vitamin E is just 15 milligrams. Dorothy's supplement contained 400 international units, which equals approximately 268 milligrams, nearly 18 times the recommended amount. Here is the critical point that could save your life. If you are taking any blood-thinning medication, including baby aspirin, and you are also taking vitamin E supplements, you are playing Russian roulette with your brain. Vitamin E is fat-soluble, which means your body stores it rather than excreting excess amounts. Over time, these stores build up to toxic levels. The irony is that the very supplement Dorothy thought was protecting her brain was actually putting it in mortal danger. Her brain bleed required emergency surgery, and although she survived, she never fully recovered her speech or her independence. But the story gets even more disturbing when we look at vitamin B6, a nutrient that most people assume is completely harmless because it is water-soluble. Most people believe that water-soluble vitamins are safe because your body can simply flush out any excess through your urine. This dangerous misconception has led millions of seniors to pop vitamin B6 pills without a second thought, not realizing that this seemingly innocent vitamin can cause irreversible nerve damage that will change their lives forever. Vitamin B6 is found in many multivitamins and is often taken separately by people who have heard it can boost energy and support brain function. What they do not know is that when taken in high doses over extended periods, vitamin B6 becomes a neurotoxin that systematically destroys the protective coating around your nerves. Robert Martinez, a 71-year-old retired electrician, came to my clinic with complaints that initially seemed minor. He told me his hands had been feeling tingly and numb for several months. He was dropping tools while working in his garage and having trouble buttoning his shirts. Robert assumed this was just normal aging, perhaps a little arthritis setting in. What we discovered was far more serious. Robert had been taking a vitamin B6 supplement containing 100 milligrams daily for over 18 months. He had read online that B vitamins could help with energy and brain fog, and since he was getting older, he thought it made sense to give his body some extra support. The recommended daily amount of vitamin B6 for men over 70 is just 1.7 milligrams. Robert was taking nearly 60 times that amount every single day. The tingling Robert was experiencing was peripheral neuropathy, a condition where the nerves in your hands and feet begin to die. The excess vitamin B6 was literally stripping away the protective myelin sheath around his nerve fibers, like stripping insulation off electrical wires. Without this protection, the nerve signals could not travel properly from his brain to his extremities. By the time Robert came to see me, the damage was already extensive. Despite stopping the supplement immediately, his numbness never fully resolved. He lost the fine motor control in his fingers that had made him such a skilled electrician. Simple tasks like writing, typing, or even holding a coffee cup became daily struggles. The supplement he thought would keep him sharp and energetic had stolen his independence and his ability to enjoy the hobbies he loved. The tragedy is that this type of nerve damage from vitamin B6 is completely irreversible. Once those nerve fibers are destroyed, they do not regenerate. Studies have shown that doses as low as 50 milligrams per day, when taken long-term, can cause this devastating neuropathy. Yet walk into any health store, and you will find vitamin B6 supplements containing 50, 100, even 200 milligrams per pill. If you are taking any supplement containing vitamin B6, check the label immediately. If it contains more than 10 milligrams, you are in the danger zone. If you have been taking high doses and are experiencing any tingling, numbness, or loss of coordination in your hands or feet, stop the supplement immediately and see your doctor for nerve conduction testing. Now let me tell you about vitamin A, a nutrient that has an even darker secret. Vitamin A is essential for vision, immune function, and cell growth. But when you take it in supplement form, especially the synthetic versions found in most pills, you can quickly reach toxic levels that put dangerous pressure on your brain. Margaret Thompson was a 63-year-old librarian who had always been meticulous about her health. She took a high-potency multivitamin that contained 25,000 international units of vitamin A, along with an additional vitamin A supplement containing another 10,000 international units. She believed that more was better when it came to supporting her immune system and maintaining her eyesight. Margaret began experiencing headaches that seemed different from any she had ever had before. They were intense, throbbing, and seemed to worsen when she lay down. She also noticed that her vision was becoming blurry, and she was having trouble reading the small print that had never been a problem for her before. When she came to my emergency room, she was also experiencing nausea and seemed confused about where she was. The CT scan of Margaret's brain revealed increased intracranial pressure. The excess vitamin A had caused her brain tissue to swell, putting dangerous pressure on her optic nerves and threatening permanent brain damage. This condition, called pseudotumor cerebri, mimics the symptoms of a brain tumor but is actually caused by vitamin toxicity. The recommended daily intake of vitamin A for women over 60 is just 2,300 international units. Margaret was taking 35,000 international units daily, more than 15 times the safe amount. Vitamin A is stored in your liver and fat tissue, and unlike water-soluble vitamins, your body has no efficient way to eliminate excess amounts. Margaret required immediate treatment to reduce the pressure in her brain. Even after stopping all vitamin A supplements, it took months for her symptoms to fully resolve, and she experienced permanent changes in her vision. The supplements she thought were preserving her eyesight had nearly cost her sight entirely. The final vitamin I need to warn you about is niacin, also known as vitamin B3. Niacin has been prescribed by doctors for decades to lower cholesterol, and many people take over-the-counter niacin supplements believing they are protecting their heart health, but high-dose niacin can cause severe liver damage and dangerous drops in blood pressure that can trigger strokes. Frank Wilson, a 69-year-old retired accountant, had been taking niacin supplements for 3 years to help manage his cholesterol. His doctor had mentioned that his cholesterol was slightly elevated, and Frank decided to try a natural approach before resorting to prescription medications. He purchased immediate-release niacin supplements and was taking 1,000 milligrams twice daily. Frank thought he was doing everything right. He had researched the benefits of niacin online and found studies showing it could raise good cholesterol and lower bad cholesterol. What he did not understand was the difference between the prescription, extended-release niacin that doctors sometimes prescribe and the immediate-release supplements available over the counter. One evening, Frank experienced what he described as the most terrifying event of his life. Shortly after taking his evening niacin dose, his face and chest turned bright red. His heart began racing, and his blood pressure plummeted so suddenly that he collapsed in his hallway. His wife called an emergency ambulance, thinking he was having a heart attack. Frank was experiencing severe niacin flush combined with dangerous hypotension. The massive dose of immediate-release niacin had caused his blood vessels to dilate so rapidly that his blood pressure dropped to life-threatening levels. The sudden drop in blood pressure reduced blood flow to his brain, putting him at immediate risk for stroke. Blood tests revealed that Frank's liver enzymes were also dangerously elevated. The high-dose niacin had been slowly damaging his liver for months, and his body could no longer process the toxic load he was giving it twice daily. Frank's liver damage was so severe that he required months of monitoring to ensure it would recover fully. The therapeutic dose of niacin, when prescribed by a doctor for cholesterol management, is carefully calculated and monitored with regular blood tests. Frank was taking doses that were appropriate for prescription use but without any medical supervision or monitoring. The difference between helpful and harmful with niacin is razor thin, and crossing that line can have devastating consequences. So what should you do instead? After sharing these frightening stories with you, I do not want to leave you feeling hopeless or confused about how to maintain your health as you age. The answer is actually simpler and more powerful than any supplement regimen you could design. Your body was designed to obtain nutrients from whole, natural foods, not from concentrated pills manufactured in laboratories. When you get your vitamins from food, they come packaged with hundreds of other beneficial compounds that help your body process and utilize them safely. These natural cofactors act as built-in safety mechanisms that prevent the toxicity we see with isolated supplements. Let me tell you about Margaret Wilson, a 72-year-old retired teacher who came to see me 2 years ago feeling exhausted, confused, and overwhelmed by the 23 different supplements she was taking every day. Her bathroom counter looked like a pharmacy, with bottles of vitamins, minerals, herbs, and specialty formulations that promised everything from better memory to younger-looking skin. Margaret was spending over $300 every month on supplements, and, despite this massive investment in her health, she felt worse than ever. She was experiencing digestive issues, headaches, and fatigue that seemed to worsen no matter what new supplement she added to her routine. Together, we made a radical decision. We cleared out her entire supplement collection and replaced them with food, real whole nutrient-dense foods that would provide her body with everything it needed, in forms it could actually recognize and use safely. Within 6 weeks, Margaret felt like a different person. Her energy returned, her digestion improved, and the chronic headaches that had plagued her for months disappeared completely. Her blood work showed improvements in every marker we tested, from her inflammatory levels to her vitamin status. Most importantly, she felt empowered and in control of her health again. Let me give you a concrete example of what Margaret's new approach looked like. Instead of taking a handful of pills each morning, she would prepare a simple breakfast that provided more bioavailable nutrition than any supplement could offer. One soft-boiled egg gave her clean protein and natural vitamin D in the exact amounts her body could process safely. Half an avocado provided healthy fats and folate without the risk of overdose. A handful of fresh berries delivered antioxidants that worked synergistically with other compounds in the fruit to provide maximum benefit with zero risk of toxicity. A slice of whole grain toast provided B vitamins in their natural matrix, along with fiber that helped regulate her blood sugar and supported her digestive health. A small glass of freshly squeezed orange juice gave her natural vitamin C, along with bioflavonoids that enhanced absorption and utilization. This simple breakfast provided more bioavailable nutrition than the hundreds of dollars worth of supplements she had been taking, and it did so in a way that was completely safe and natural. Her body recognized every nutrient and knew exactly how to process it without creating toxic buildups or dangerous interactions. The most important lesson I have learned in my decades of medical practice is that awareness is the best medicine. Your body changes as you age, and what might have been safe for you at 40 could be dangerous at 70. The supplement industry wants you to believe that more is always better, but when it comes to your health, more can be deadly. My goal today has not been to frighten you, but to empower you with knowledge that could protect you from preventable tragedies. Every patient's story I shared with you represents a real pattern I see repeatedly in my practice. These are not rare, isolated incidents. They are becoming increasingly common as more seniors turn to high-dose supplements without understanding the risks. You are not alone on this journey toward healthier aging. If this information has opened your eyes to potential dangers you were not aware of, please give this video a like to help other people find this critical information. When you like and share content like this, you are literally helping to save lives by ensuring that more people who need this knowledge will have access to it. I also want to ask you to subscribe to this channel and turn on notifications, so you never miss updates that could impact your health and safety. Every week, I share evidence-based information that cuts through the marketing hype and gives you the truth about what really works for healthy aging. If this content has provided value to you and you want to support the creation of more in-depth health education like this, consider leaving a super thanks. Your financial help allows me to continue researching and bringing you the most current, life-saving information available. This support helps the channel reach even more people who desperately need access to this type of honest, science-based health education. In the comments below, I want you to tell me what is one change you will make after watching this video. Will you check your supplement labels? Will you get your blood levels tested? Will you start replacing some of your pills with whole foods? Your commitment to change could inspire others to take action that saves their lives. Remember, the goal is not to live in fear, but to live with wisdom. Your health is your most precious asset, and you have more control over it than you might realize. But is that all? What other hidden dangers might be lurking in your medicine cabinet right now? What else should you know about the supplements that promise to keep you young and healthy? The answers might surprise you, and they could change everything you thought you knew about aging safely.